Michelle Obama once said, in order to instill true change, one must be comfortable enough to be really honest and say something incredibly uncomfortable. Over the next 10 minutes, I will change the way you view your role in the oral and systemic inflammatory process. But that begins by me saying something incredibly uncomfortable to a room full of my esteemed colleagues. And that is this: the oral systemic link is a myth. Just like the tooth fairy, the oral systemic link is something that we've heard about, we've read about, our friends have told us about. The oral systemic link is very similar to the tooth fairy in that it puts money under our pillow every night, because we know the oral systemic link is a beautiful cherry on top of our treatment planning for systemic diseased patients. But the truth remains, the oral systemic link is a myth. And here's why. If Dr. Emmett Brown showed up in his DeLorean today, opened up those side doors and invited all of us in, and we went back to the 1950s, we would see something very interesting. We would notice that dental providers in the 1950s treat oral inflammation with a prophylaxis and a 6-month recall, or scaling and root planing with soft tissue curettage and chlorhexidine irrigation. Albeit they were not wearing gloves or a mask, and they were in skirts, which I always thought was weird, because when you want to sit in that wide stance as a hygienist, that was a bit odd, right? But I'm sure they sold a lot of dentistry that way. Thanks, guys. We save the clock tower, we get back in our DeLorean, and we arrive in 2018, where today we are performing the same services: prophylaxis with 6-month recall, scaling and root planing, soft tissue curettage, and chlorhexidine irrigation. Despite the overwhelming amount of research that identifies specific bacterial markers to systemic disease, we are performing the same procedures that dental providers did 70 years ago. So, I'm not here to tell you today that the oral systemic link isn't real. The myth is that we believe we're doing enough. So, join me today as I talk about Katrina's Easy 3 simple steps that you can integrate into your clinical practice starting tomorrow. These 3 steps will allow you to take a seat at the table and truly manage the oral inflammatory process for your patients. Beginning with step number 1. Step number 1 is microbial testing, or understanding the DNA of the bacteria that live in our patients' mouths. I discovered this concept one day when I took my dog Darby to the vet. Yes, I am that much of a hygiene nerd. I named my dog Darby. I brought Darby to the vet because Sweet Darby is a pug beagle mix, and his giant floppy beagle ears means that sometimes he gets ear infections. Brought Sweet Darby into the vet sat Darby down, extracted a little waxy buildup from his ear, placed it on a slide, and looked at it under a microscope. Darby's vet was able to identify the bacteria, virus, fungus, or yeast that was causing his acute ear infection, and was able to address that infection very directly. By being precise, Darby's vet was able to provide an effective treatment. Now, I'm not suggesting that we surprise our patients with a cold thermometer up the rectum, but I do think that there are some things that we can do in dentistry in order to take an active role. So I find it very interesting that Darby's vet treated his ear infection with more concern than I did in private practice to systemic diseases that can be life-threatening to my patients. Taking a salivary sample, sending that off to the lab, and having a report comes back allows me to have a very eloquent conversation with my patient. I can now sit down with 55-year-old Bob and say, Bob, you tested positive for high levels of Fusobacterium nucleatum. And I know that bacteria is directly linked to colorectal cancer. Bob, you're 55 years old. When is the last time you had a colonoscopy? And now that conversation is real. So, step number 1, microbial therapy, or understanding the microflora biofilm that our patients experience during oral inflammation. Step number 2, identifying the importance of creating a customized or personalized recare frequency. Now, this isn't a new concept. We oftentimes see patients with inflammation, but where did this idea that seeing patients every 6 months come from? Well, I did a little bit of research on it, and I found, going back to the 1950s, Bucky the Beaver was the spokesbeaver for Ipana toothpaste. And Bucky the Beaver, I'm not going to sing for you, you don't want that, but Bucky the Beaver had a commercial where he would sing, "Brusha, brusha, brush out with the brand new Ipana." And at the end of the commercial, that stupid beaver said, "Brush your teeth with Ipana and see your dentist twice a year." And that is why insurance companies allow us to do 2 dental cleanings in a calendar year. With the insane amount of research that we have on the oral inflammatory process in systemic disease, we let a beaver from the 1950s tell us what to do. Isn't that amazing? So, I implore all of you, hygienists, dentists out there, to consider identifying customized or personalized frequencies of recalls for your patients. Moving on to step number 3, nutritional counseling. Now, as dental providers, we've used nutritional counseling before. We've talked about nutritional counseling when we have patients with extreme decay. How much soda have you been drinking? How much sugar have you been consuming? And we know the importance of fermentable carbohydrates. But research is telling us a little bit more. First of all, research is telling us that the new consumption of Tide Pods is really helping to keep the oral cavity clean. We also are learning, however, that there are specific food products, low glycemic index, anti-inflammatory food products that allow our patients to fight the inflammatory process from the inside. And we know that because we know that food can heal us, and we know that food can make us sick. So I implore you to consider integrating nutritional counseling, but specifically nutritional counseling that encourages your patients to consume anti-inflammatory, low glycemic index food items. I've given you today Katrina's easy 3. Step 1, your microbial testing. Step 2, personalized frequency of recalls. And step 3, nutritional counseling. I can't stand before you today without giving me a fried shrimp emoji. So I'm going to ask all of you dental providers out there, if you think you can integrate any 1, 2, or 3 of these into your clinical practice starting tomorrow, throw me up a fried shrimp emoji. I call these my easy 3 because they are simple. They are doable, but more so, we are qualified and compelled to do these things for our patients. We have an amazing capacity to heal. That is who we are as inflammatory specialists. And I guarantee that when you decide to take that seat at the oral and systemic table, that you will not only create an opportunity for your patients to have extreme health, but you will receive extreme reward, because we're all going to eventually have to be the change we wish to see in the world. As for me, I'm done for today. Doc Brown is parked outside. I'm going to go back to the 1950s and take care of a spokesbeaver. Thank you for your time.